Hello friends, my name is Neeraj Kumar Singh and you're watching channel Money Device. So as we all know that coronavirus is spreading at a very rapid rate all around the world and government around the world are trying every possible preventive measure to fight with this coronavirus. So in this video we'll discuss some techniques through which we can reduce the adverse effect of coronavirus. So let's start. So first of all we'll discuss the theory flattening the curve. So first of all, let's understand what is the curve. It is the comparison of projected number of infected persons over a given period of time without protective measures and with protective measures. So what is shown in the curve? In the curve there are two situations shown. In first situation, we don't use protective measures and spend our daily life like we used to do before the virus spread. Then as per the behavior of the virus and the trend of its spreads, which is seen till now, it will start growing at an exponential rate and will achieve its highest number of infection in a very short time and give a steep rise and a steep fall after infecting almost everyone it can infect, which will surpass the capacity of health care facilities like beds, ventilators, respirators, ambulances, doctors, masks, medicines, nurses, etc., which will ultimately result in many cases left untreated and will increase pressure on healthcare system, which will result in more number of deaths and less number of recovered patients. On the other hand, in second case, if we follow protective measures, then although the total number of infected persons overall can be the same, but the rate of infection will be slow and the total number of infected persons will be under the capacity of healthcare facilities and the graph will also be flatter and thereby less burden, less pressure and good take care of patients will result in more recovered patients and less number of deaths. So what are the protective measures that we can use to flatten the curve? So first is social distancing. So there are various methods of social distancing that you can use to flatten the curve. I have also made a video on social distancing, link of which is given in the description, which you can use to understand what is social distancing and how to use social distancing. Number 2, washing hands every hour for 20 seconds each. Point 3, stay home until it is very important to go outside. Number 4, wear face masks. Number 5, eat diet that boosts immunity. Number 6, exercises at home to boost immunity. Number 7, wash everything with hot water for whatever comes inside the house. Number 8, use hot water in all tasks wherever possible like drinking water, bathing, cloth washing, etc. Number 9, self-isolate or self-quarantine yourself if you are sick or have traveled any infected places. So in brief, flattening the curve means to slow down the rate of infection to match the capacity of healthcare facilities, to increase the recovered patients and to decrease the mortality rate. And what is mortality rate? It is unit of deaths per 1,000 individuals per year. So as we have understood what is flattening the curve means, so the question is, does it really works? So the proof is that as per the analysis by Dr. Drew Harris, a population health analyst, says during 1918 Spanish flu pandemic in Philadelphia, in spite of being warned by experts about the spread of virus that was already going on at that time, the city officials moved forward with a parade with 2 lakh people together. In a result, within 2-3 days, thousands of people got infected and many died, with 16,000 deaths counted in 6 months. Whereas in St. Louis, city officials used protective measures, closed schools, avoided unnecessary travels, and followed hygiene practices and followed social distancing. As a result, there was only 2,000 deaths in 6 months, fourth part of that of Philadelphia. The analysis by Dr. Drew Harris clearly shows that we can reduce the horrific results of any pandemic by flattening the curve. So, what is social distancing? Social distancing are the steps to reduce social interaction between people to avoid spreading illness. And what is isolation? Isolation is a process of keeping an infected person away from a non infected person at home, hospital, or care facility. In this case, special personal protective equipments are used in healthcare settings. What is self quarantine? People who have been exposed to the coronavirus and are likely to get symptoms might practice self quarantine. It lasts for minimum 14 days to 21 days. In 2 to 3 weeks, they get to know whether they become ill or infect other people. Anybody travel to corona infected place or has exposed to an infected person should practice self quarantine. What and how to do self quarantine? Stay at home, follow standard hand washing and hygiene on frequent basis. Don't attend any visitor. Don't share personal belongings from close to utensils. Maintain 2 meter distance from other people in your household. So by using all these methods, we can keep ourselves and our families safe from the deadly coronavirus. So stay home, stay safe. Thank you very much for watching the video. Hit a like and subscribe my channel for more videos to come.